welcome back to my general anatomy lecture series, lecture number 13, in which we will talk about the joints anatomy and its classification. This lecture has the following content. What is a joint and how to name a joint? The relationship of a joint mobility and stability and the classification of the joint. First of all, what is the joint? A joint is an articulation or a point of contact between two or more bones or a bone and a cartilage. Then how the joints are named? The joints are named on the basis of the articulating bones. For example, the interphalangeal joint is a joint between two phalanges, while the metacarpal phalangeal joint is a joint between a metacarpal and a phalanges. The relationship of a mobility and the stability is an inverse relation. The more the joint is mobile, the less stable is the joint. For example, the glenohumeral joint is the most mobile joint with the least stability, while the suture joint is immobile, having the most stability. The joints are classified on the basis of the moment and on the basis of the structure. On the basis of the moment, there are three types of joint: synarthrosis, amphiarthrosis and diarthrosis. The synarthrosis are immobile joints, while the amphiarthrosis are slightly movable joints, and the diarthrosis are freely movable joints. In the structural classification, there is a fibrous joint in which the bones are held together by dense regular connective tissue, and a cartilaginous joint in which the bones are joined by a cartilage. The synovial joint has bones joined by various ligaments. The first fibrous joint is joined by the dense fibrous tissue. They are mostly immobile to slightly movable joints and have no joint cavity. They have further three subtypes. The suture joint. They are the joints of the skull. They are fixed, affected by the sutural ligaments, and the process of obliteration of suture or the fusion of suture is called the synostosis. The joints of the skull are the sutural joints. Then the second type is the comphosis, also known as the peg and socket joint, in which the peg is fit into the socket. The example is the teeth that fit into its alveolus, and they are held together by the periodontal ligament. The third type is the synosmosis, in which the articulating bones are joined by ligaments only, and there is no bony contact. They allow slight movement and classified as amphiarthrosis. The example is the middle radial ulnar joint. There are many varieties of sutures depending on the shape of the articulating surfaces and the mode of fusion of articulating bones, as the serrate suture, which have sword-shaped articulating surface. The example is the sagittal suture, and the denticulate suture that have teeth-like articulating surfaces. The example is the lambdoid suture, while the squamous suture have overlying bony surfaces. The example is the temporoparietal suture. And the limbus suture is a modified squamous suture in which the overlying surfaces are the ridges. The example is the modified temporoparietal suture. The plain joint have flat articulating bony surfaces. The example is the interpalatine suture. The wedge and groove suture has wedge, and a V-shaped groove. The example is the humerosphenoid suture. The second type, cartilaginous joint, are attached to each other by a cartilage, and they also lack a joint cavity. They have two subtypes, synchondrosis and symphysis. Synchondrosis are synarthrosis or immobile. They are temporary that can be replaced by a bone later in life and have articular cartilage. While the symphysis are the amphiarthrosis or slightly movable joints that are permanent and have fibrous cartilage. The example of the synchondrosis is epiphyseal cartilage, while the example of the symphysis is pubic symphysis. Then the synovial joints. Synovial joints are freely movable articulations and classified as diarthrosis. The bones are separated by a space called a joint cavity that is not present in a case of fibrous and cartilaginous joint. In a synovial joint, the bones are enclosed within a capsule. The synovial joints are further subdivided into many types on the basis of the axis of the movement, types of the movement they allow, the complexity of the articulating bones, the shape of the articulating surfaces. According to the shape of the articulating surfaces, there are planar joints in which the articulating bones have flat surfaces. The example is the joint between tarsal bones. The saddle joints have reciprocal concavo-convex articulating surfaces or the articulating surfaces resembling the shape of the horse seat. The example is the joint between the trapezium bone and the first metatarsal bone. Then the hinge joint that have a shape of a door hinge and allow movement only in one plane. The example is the elbow joint. Then the pivot joint that has a shape of a pivot and also known as the rotatory joint as it allows a rotatory movement. Example, the pivot joint is a joint between the C1 and C2 vertebrae. The bowl and the socket joint, as the name indicates, in which the one articulating surface resembles a bowl while the other articulating surface is a socket shaped. The example of the ball and socket joint is a hip joint. In a condyloid or ellipsoid joint, one articulating surface is convex or condyle shaped, while the other articulating surface is concave or ellipsoid shaped. Example of the condyloid joint is the joint between the radius and the carpal bones of the wrist. According to the complexity of articulating surface, in a simple joint, two bones articulate together to form a joint, while in a compound joint, more than two bones articulate together to form a joint. In a complex joint, more than two bones articulate together and the articulating surface has an inter-articulating disc or a menisci. According to the movement they allow, there is a gliding movement, angular movement, rotation and circumduction. Gliding is a sliding-like movement that usually occurs at a planar joint. The angular movement increases or decreases the angle of the long axis, like flexion and extension. While the rotation is the movement occur around the joint. Example is the pivot joint, while the circumduction is the combination of all the movement that occur on the ball and socket joint. According to the axis of movement, there is uniaxial, biaxial and multiaxial. In uniaxial, the movement occurs in one axis. Example is the elbow joint. Only flexion and extension occur at an elbow joint. The biaxial is the movement that occur in two axes. Example is the wrist joint, on which flexion, extension, ulnar deviation and radial deviation occur. The multi-axial joint is the joint on which movement occurs in more than two axes. The example is the shoulder joint or the hip joint, allowing circumduction. For more videos, like, share and subscribe. And don't forget to press the bell icon. Thank you.